Hey guys, welcome to my YouTube channel. This is Shahin, a sixth-year medical student who shares scientific facts of training and nutrition published in valid journals. Hope you guys like it. Supplementing with creatine is very popular amongst athletes and exercising individuals for improving muscle mass, performance, and recovery. So we talk about creatine in the first video, based on an article that published in the Journal of the International Society of Sports Nutrition in 2021. With this title we begin, Common Questions and Misconceptions about Creatine Supplementation. What does the scientific evidence really show? Here are the questions that we will respond by this article. 1. Does creatine lead to water retention? 2. Is creatine an anabolic steroid? 3. Does creatine cause kidney damage or renal dysfunction? 4. Does creatine cause hair loss or baldness? 5. Does creatine lead to dehydration and muscle cramping? 6. Is creatine harmful for children and adolescents? 7. Does creatine increase fat mass? 8. Is a creatine loading phase required? 9. Is creatine beneficial for older adults? 10. Is creatine only useful for resistance, power-type activities? 11. Is creatine only effective for males? 12. Are other forms of creatine similar or superior to monohydrate? And is creatine stable in solutions or beverages? Here are the answers of the questions according to the article. 1. While there is some evidence to suggest that creatine supplementation increases water retention, primarily attributed to increases in intracellular volume, over the short term, there are several other studies suggesting it does not alter total body water, intra- or extracellular, relative to muscle mass over longer periods of time. As a result, creatine supplementation may not lead to water retention. 2. Because creatine has a completely different chemical structure, it is not an anabolic steroid. 3. Experimental and controlled research indicates that creatine supplementation, when ingested at recommended dosages, does not result in kidney damage and/or renal dysfunction in healthy individuals. 4. The current body of evidence does not indicate that creatine supplementation increases total testosterone, free testosterone, DHT, or causes hair loss or baldness. 5. Experimental and clinical research does not validate the notion that creatine supplementation causes dehydration and muscle cramping. 6. Based on the limited evidence, creatine supplementation appears safe and potentially beneficial for children and adolescents. 7. Creatine supplementation does not increase fat mass across a variety of populations. 8. Accumulating evidence indicates that you do not have to load creatine. Lower daily dosages of creatine supplementation, that is 3 to 5 grams per day, are effective for increasing intramuscular creatine stores, muscle accretion, and muscle performance each recovery. 9. There is growing body of evidence showing that creatine supplementation, particularly when combined with exercise, provides musculoskeletal and performance benefits in older adults. 10. There is a variety of athletic events, not just resistance or power activities, which may benefit from creatine supplementation. 11. There is accumulating evidence that creatine supplementation has the potential to be a multifactorial therapeutic intervention across the lifespan in females, with little to no side effects. 12. While some forms of creatine may be more soluble than creatine monohydrate when mixed in fluid, evidence-based research clearly shows creatine monohydrate to be the optimal choice. I finished my first video right here. If you want this channel to continue uploading this kind of videos, do not forget to like, comment, and subscribe. Thanks.